So a question I get asked an awful lot is, what's this lump? And usually some bit of a pet's anatomy is presented to me. And assuming it's not something like a clump of hair or a grass seed or one of those sticky balls or something like that, it's actually part of the animal. There's really only one of 5 things it can be. And I want you to remember this acronym, CHANG. C-H-A-N-G, CHANG. So that's the acronym that I use to remember all the different diagnoses for types of lumps. So what does the C stand for? Cyst, that's the first one. Cyst is essentially a non-malignant, it's benign growth. Essentially it's a fluid-filled sac in the skin or under the skin that's slowly expanding with fluid under the pressure of fluid. And generally you can stick a needle in it and we get sort of a dirty brown liquid out of it, and that tells us it's a cyst. Usually not inflamed, they're not infective, they're not painful, and they appear as a really discrete lump within the skin. So by discrete I mean you can get your fingers around them, and they can be anything from really small to pretty large sometimes. So that's C, cyst. I ought to say as well, with cysts we can drain them. We can drain them until the cows come home, but they always come back again, and really the only treatment for them is to surgically remove them. The next one, H, stands for hematoma, posh medical word for essentially a bruise. So a collection of blood under the skin. So perhaps you had a bang and you see a slight lump underneath the skin. That could be a collection of blood under there. Pretty uncommon, because you really do know about it if you bang yourself that hard, and there's generally other problems as well at the same time. So not many hematomas come in with people saying, I don't know what this lump is, because they've seen an incident which has caused it. They can be treated just with sort of ice. You can drain them, but in general they'll just disappear with time as the blood gets reabsorbed. A stands for abscess, and everyone knows what one of those are. They tend to present as being really sort of red, hot, painful. If you remember all those terms I did in the video about when should we use antibiotics, Rubra, Turgor, Dolor, Cala, redness, pain, swelling, heat. These are all signs of an abscess. They can present sort of as a mild lump within the skin, or they can be sort of really quite large. And one of the most satisfying parts of my job is to lance an abscess. Just seeing that pus come out and the relief it gets, absolutely fantastic. Doesn't get any better than that. So CHAN is the next one of CHANG. N stands for neoplasia, and this is the big C, cancer. That's what everyone would call it, I guess. We tend to use the word neoplasia because if you say cancer to someone, everything just shuts down and they hear nothing but cancer, cancer, cancer for the rest of the consult. Neoplasia goes all the way from really the most benign of the benign when it comes to lumps, so I'm talking about really benign little fatty lumps, all the way up to the really nasty lumps, mast cell tumours, mangiosarcomas, all this sort of thing. Really nasty lumps. It's impossible to give a prognosis to these things, or a real definite prognosis as to what they're going to do without knowing exactly what they are. However, we can generally get a bit of an idea. So a lipoma is smooth, it's underneath the skin, it's kind of a domed feeling. It feels a little bit like a solid jelly, I guess. Just like fat, whereas the more malignant lumps, they tend to be harder, a little bit lumpier. They tend to not have a really clearly defined margin. They can be painful sometimes, but there's a very big overlap as well. Some benign lumps can look a little bit like nasty ones. Some nasty ones can look a bit more like benign ones. I'm thinking particularly of mast cell tumours and things like that. They can present in all kinds of ways and can range from absolutely not too much of a problem all the way up to really, really nasty. So we do need to know what we're dealing with. And generally, what we can do is do a biopsy, which take a little bit of it away and send it to the lab, or look at it under our microscopes and basically make a diagnosis on that. Biopsies can either be just a simple needle, what we call fine needle aspirate, and we'll suck up some of the cells that are in there and look at the types of cells that are in there, and from that we'll be able to tell you what the tumour is. The only problem is that we don't get an idea of how it's all put together. It's rather looking like a brick from a house and telling you whether it's a semi-detached or a detached. You get an idea, but not an absolute positive diagnosis. Much better is what we'd call either a punch biopsy or an excisional biopsy, where we take a chunk or maybe even the whole lump itself and send it off to the lab. And what they can do then is they slice it very finely, and they can look at the cells that are in there, but they can see how all the cells are put together, and that gives us a much better idea about what's going on. We might even take local lymph node biopsies and things like that. So that's neoplasia. I'm not going to call it cancer, because cancer is sort of a whole syndrome of things. Neoplasia is, I'm going to call it these lumps that we can find. And then G stands for granuloma, which is a granulocyte is a type of white blood cell that you usually find in response to insect bites and things like that. So granuloma is a lump that's formed as a result of an insect bite or something that's caused a granulocytic reaction. So the classic one here would be tick mouth parts embedded in there, and essentially the body has tried to wall it off, and it's caused a little lump around those tick mouth parts, and that's what causes a granuloma. Again, not much you can do about those. They can shrink down a little bit. If they get infected, we can treat with antibiotics, but in general the only permanent solution is to permanently remove them. So there you go, five types of lumps: cyst, hematoma, abscess, neoplasia, granuloma. Chang. Easy. Thanks for listening. Bye.